You're listening to Healthcare Now Radio. Stand by for This Just In, the latest in healthcare innovation and technology trends with your HIT advisor, Justin Barnes.
Thank you for tuning in and welcome to This Just In. I'm your host, Justin Barnes. In these half-hour segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. For this episode, my 105th episode, we're going to speak to a good friend and industry thought leader, Tom Foley. Tom's Director of Worldwide Health Solutions and Strategy for Lenovo Health, as well as co-founder of the Health Innovation Think Tank. Welcome back to the show, Tom.
Thank you very much. Good to be here. Good to talk to you, Justin.
Yeah, it's great to have you on air again. We always have a lively conversation. Certainly a lot in common, and I couldn't be more excited to kicking off another Think Tank session with you. So, and we're really going to have a special show today. Usually we cover a lot of great content on specifically on one company or what corporate strategies are occurring around the industry and the best practices there or some really cool innovations. But we're going to couple a lot of that all into one show and kind of cool like a broad swath across a lot of companies that participate in our think tank. And again, we have our second one scheduled in a little bit at UPMC in partnership with the Center for Connected Medicine. But let's start off, Tom, with a little bit of background on where the think tank came from, because it came from really a brain trust that you had at last year's HIM. So let's kick off there.
Yeah, good question. So we're always talking with clients and the broader market about need and where the puck is going. Mm-hmm. And there was a lot of, and when we talk to clients about innovation, typically the inhibitor was who's going to pay for that and who's going to support that, and we need policy change. Mm-hmm. Telehealth is a perfect example, right? Yep. Great innovation, necessary to achieve value-based care, in my opinion. Reducing cost, increasing the value, moving the setting of care to the home. But there's a lot of policy and a lot of other aspects that were necessary. So actually it was on your show then when you had interviewed me at HIMSS, where we were talking about needing to create a construct of a forum of thought leaders in healthcare, bringing the vendors together, bringing policymakers together, bringing the payers in, and also bringing pharma in. Yeah. And let's have a discussion on, well, how do we move the continuum forward? How do we influence policy relative to the acceleration of a value-based care model? Individual health systems could potentially do it on their own, and that's great, but there's a larger market out there that wants to get there too, may not have the wherewithal or the influence that a larger health system might have. So let's help guide them on what it takes to let's help create the influence to make policy changes, and let's collaborate with other IT vendors and health systems to help facilitate a path forward. Ultimately, it comes down to what and defining best practices on how we got there, and so others can leverage that to move the ball forward in their respective neighborhood.
Yeah, I mean, you're spot on. I mean, a lot of the industry comes together in silos. So if you're health systems, you collaborate amongst other health systems, and vendors and innovators tend to have their associations and collaborate. And there's certainly some cross collaboration, but I think what you and I really saw out there is that there's not a collaboration that cuts through all of these key stakeholders and all of these collaborations and bring them all under one roof. And so, like you said, we have health systems, we have innovators, we have true key thought leaders, we have policymakers, we have payers, we brought in pharma, we brought in everybody into one room. And again, this is a think tank style. So I mean, it's everybody in there there are experts in their own right and experts in their own field and have a lot of just knowledge, wisdom, and inherent best practices that they work from every single day. So let's get in a room and let's share that and keep that ecosystem small. We kept it to 50 people. We had our very first one back in June, actually at Lenovo's headquarters in North Carolina. And now we're going to have our next one at UPMC in Pittsburgh. But, I think the key is keeping it small, keeping it intimate from a standpoint of people feel comfortable to speak up. You're not speaking in front of 1,000 people, no matter who you are. Sometimes you get nervous in front of 1,000 or even 500 people, but we give it to 50 real key thought leaders in key constituencies inside of their respective world, and it's just been tremendous.
Yeah, and a key differentiator and what I love about the think tank is, and with no disrespect to how conferences run and things of that nature, conferences, you have a keynote speaker and they stand up and speak and everybody else listens. You have a panel discussion and the panel speaks their different opinions, and everybody else listens. Here, everybody speaks. We do have catalysts that kick off a conversation, give a perspective, but yet then the other 49 participants in the room actually get to contribute. Ultimately, it's that collaboration and that deep thinking in that tank that ultimately gives us the ability to move the ball forward.
Very true. So we started off, we have three main or core themes: value-based care, connected health, and virtual care. And why don't we set up the show? I mean, I think really it would be great to set the stage for our audience and really begin, because we, to be honest, Tom, you and I don't know exactly where this think tank is going to go. We know we have a tiger by the tail. We know we have a ton of interest. We know there's a lot of people looking forward to seeing what best practices this core group will create, and we are creating. And I actually think, we'll do this event at UPMC. I believe we'll do our third event at HIMSS 18 annual conference in Las Vegas come the first week of March. But let's dive in and give everybody a little bit of a taste of some of the key takeaways, I think, from the first session. Because I think really those key takeaways we're going to build on and build from for the second one that's coming up. But let's talk a little bit about the key takeaways. So let's start off with value-based care. And again, just for our audience, the three main core themes and strategies for the think tank right now are value-based care, connected health, and virtual care. So let's talk about some of the key takeaways. We have some great, just great cross collaboration. Value-based care is front and center for everyone in healthcare that certainly wants to not only survive but to truly thrive. Come even this year, but certainly moving forward. So, why don't you lead us into some of those key takeaways, Tom, around value-based care that we saw in the first think tank?
Yeah, the number one takeaway in the value-based care segment was some efforts and some comments that Holly Miller was leading. And, it was around, this isn't around technology. Yep, there's a technology influence. There's no doubt about it. However, her belief, and I believe it was a consensus of the think tank, that 80% is really around process. Right. And it's 20% really around technology, and then the culture around that. So, how do you build that culture that leverages the right processes and that 20% technology mix that moves the ball forward as well? This cannot be done. Value-based care cannot be done in a vacuum in the context of what a healthcare system is doing. If you don't have a true patient-centered care model driving value from a patient's perspective, you're never going to achieve a value-based care model. Not going to happen. Yeah.
No, so true. And I think I loved, because she started off, Dr. Miller really kicked it off well with she called it the 80-20 rule. And so needless to say, we all kind of perked up because we know the 80-20 rule in a lot of markets and a lot of discussions. But 80% process, 20% technology, and 100% culture. And from you and I are in this every single day, knee deep, and we certainly that rang true for us and what we knew to be true. And the other one I think that she brought up, or at least was brought up as one of the key takeaways, was the misalignment between acute and ambulatory incentives. Yeah. And I think that's something that I know Dr. Price and HHS continues to look at that They understand there's an issue there. And we need to just keep an eye on it. That was kind of the policy perspective that arose, at least from that first discussion. We really do need to give people a glide path from fee-for-service into value-based care, and not be scared. And I really do believe the quality payment program, MACRA, MIPS, the QPP, that really is beginning to align some of those incentives. But I think what we got from the room is there's still a lot of fear from the QPP and moving forward with MIPS and the various programs. However, when you really dive into MIPS, it is still 95% fee for service. It is not a dramatic shift. It is 95%, and no one would say that's a significant of anything. It's 95%. I mean, significant in the direction that you were going. It's only 5%.
Right.
Right.
And ultimately the alignment between acute and ambulatory. Again, not everybody really goes to the hospital, so there has to be this correlation between the two. I think the issue was more of, as we talked about during the value-based care session, is really about covering the care gap. Mm-hmm. It's that 8,760 hours in a given year versus the 15 hours that the average Medicare patient with 5 different doctors or 10 different doctors spends in front of them on a given year. The difference between the two numbers is the care gap. So if we're going to close it, we have to focus on the patient, hence the patient-centered care model, and what happens. It's more important, I would say, that it's more important for what happens when you're not in front of the doctor.
Right.
Versus when you are in front of the doctor. When you're in front of the doctor, things are going to happen.
Right.
But the only doctor that can actually heal you is a surgeon. A general practitioner can only advise. The patient has to engage and follow.
Right.
And engage and work towards that care plan. Other than that, we're never going to achieve again that sense of wellness. Classic model of 30 to 50%, depending on the study that you listen to. Patients don't fill their scripts. As simple as that simple model is, geez, I've gone to the doctor, I got diagnosed, the doctor gave me a script, but I'm not going to go to the pharmacy and fill it.
Well, yeah, and so
why spend all that money?
Yeah, you're spot on. It's certainly getting to the true wellness, but also we need to engage that to really bend that cost curve. We've got to begin bending this cost curve. So you bring up a great segue into our next key topic and key strategy is connected health and some of those. So go ahead, walk us through some of those key takeaways. I know we had a lot. I mean, that was obviously a big conversation as well. But yeah, walk us through some of those from a high level.
Well, the issue here is that we have a patient that traverses the continuum of care and sees many different doctors, as I just gave in that example. The average Medicare patient has 5 chronic conditions, sees 9 different doctors. They may not all be in that health system, and they go from the hospital to their cardiologist to their general practitioner. How do we share that data? How do we create this connected ecosystem in order to achieve that level of success? And how do we know that one record coming from a system A, or I'll just say EHRA, is mapped to the same patient in another health system with a different EHR? Mm-hmm. And one of the things that came out was that the whole patient ID and matching the system is stated to be an imperative by the think tank. And having some open APIs and infrastructure on how do we better share that data. Ultimately, that drives a drastic difference in just being able to better manage the data. One patient, one identity, one record across a continuum of care. We're going to be able to make better clinical decisions and move that patient towards wellness. And then some other elements that they have here is, again, it goes back to value-based care, patient interaction with the healthcare system, not to be linear. It's a circular, continuous, and complex flow. So we need to make sure that both parties are engaged in that effort. just looking through the list here and just picking out some of the highlights. Transparency in terms of connected health. Quality of the provider and the organization is needed. How will the patients compare the cost so that they can, I'm not always a believer that, cost is the underlying factors, but I'm certainly cognizant of people's challenge in covering their portion of the delivery of care. So cost is always an important factor on how they engage their health system and their to be able to achieve that wellness. So there's and then the other part is that if the home truly is going to become the setting of care, which
it is,
I think everyone has agreed to.
Yeah.
Then what is, and this is where we're going to dive a little deeper in the second think tank.
Yeah.
What is an intelligent medical home? What do you need, and how do you collect vital information in the home, engage them, and communicate that data to the respective care team? Because the bigger challenge here, again, policy change, is I got all this data now, but my physician doesn't want to see it because of data fatigue and alert fatigue and things of that nature. So how do you create these interceptors that the patient is given at least guidance on, hey, I just took my blood pressure. Was that good or was that bad? And what should I do? So being able to provide a health coach, if you will, and have the health systems be able to provide some analytics on top of that, are some of the things that we need to work through those workflows, and what technology makes best sense to facilitate that connected ecosystem.
Yeah, and one of the ones, and you bring up that you actually transition right to a great point for me. Out of that second session, that connected health session, the key takeaway: risk stratification, supportive technology, and process redesign really are our key success factors. And that Hank Fanberg brought that up from Christus Health. And I agree. You've really got to look in to understand what populations you're going to use, what technologies, and then how are you going to implement that across your organization with that population. It's not just about, using a new wearable across a subset of patients. You really need to look in there, understand what pool or population is going to be best suited for this technology, this innovation, and then how can we implement that within the protocols in the workflows that we already use and have, or can update here at our institution. There's a lot to it. I think that's when you really look at your population, you look at what is the best innovation to use, and how can we update or redesign our processes to maximize the outcome here. I think that's a really good kind of 1, 2, 3 punch that Hank and Christus does, and I think it's a great strategy.
Yeah, the fundamentals there are, if we're going to transform the delivery of care, the word redesign is an absolute, as opposed to saying we've been doing this for years, it's been working. It may work today, but it's not going to work when I've been doing a lot of research on the concept of a bedless hospital.
Yeah.
So think about that in the context of every hospital system today. They manage success by maximizing the occupancy of their beds. And tomorrow, I'm going to be meeting with Dr. Jack from Boston Medical Center on Monday, and his view is that in the future is that the hospital manages success when the beds are empty.
Right.
So what is that bedless hospital, and how do we deliver care in that particular model? That's ultimately the vision that the folks in the think tank are striving towards. It's not going to be done in a day, not going to be done in a year.
Right.
But we're here to paint that roadmap and what are the incremental steps to ultimately achieve that level of success.
Yep. No, I agree. And one last piece here on the connected health aspect is people are looking at gaming and gamification to see how can we enhance usability and engagement. So for innovators, if you're not looking outside of just health IT and healthcare, you could be really losing something, and certainly on having the stickiness. Gaming and kind of the whole virtual aspects of reality and technology is one of the fastest growing, if not the fastest growing market right now globally. And you really got to look at how gaming and gamification of technology can assist you in the usability of your products and certainly really get that engagement. Because again, you and I just talked about it several times. Without patient engagement, you are not going to get there. So,
yeah, and the clarity of patient engagement is we always talk about if the hospital system is moving from volume to value, the patient has to move from awareness to wellness, and that is an educational process. Education creates that awareness. Awareness creates action to be more educated, and then it allows them to move towards that degree of wellness that both parties are looking to achieve.
Yep. So actually, we're running low on time here. We got virtual care to go through. We've only got about 5 minutes left in the show. So I know we probably need to do a couple more shows on this. But the third strategy that we're focusing on in the think tank, and again, the reason why we're doing this show is begin to get these key success factors and these key strategies out there. We will publish all of this. Certainly look to us for the Health Innovation Think Tank, and we're going to begin publishing all of these. But let's talk about virtual care. I know it's near and dear to your heart. It's near and dear to my heart. So in a couple of minutes here, cover some of the top key takeaways, Tom, from our first think tank on virtual care.
Well, here's where we wrap up and we take all the information that we talked about with virtual care, connected care. It all culminates in what is virtual care. And ultimately, it's about this is where legislative action may be needed. This is where payers need to jump in and start seeing the reality of its value and reimburse it across the board with no inhibitors. And ultimately, if I have this connected care system, I'm collecting data, I'm sending data. The last part of the equation is being able to engage that patient, not to be able to call the health system up and say, hey, my blood pressure is really high, I think I need to come in. Right. Or my sugar is really high, I think I need to come in. Oh, and by the way, the next appointment that I have is 3 weeks from now. That doesn't work. So to be able to immediately engage in that patient in that home is key. So, and that ultimately works towards reducing readmittance and another costly elements of the delivery of care. Yeah, keeping that patient again in the home, being able to be managed effectively and efficiently. They want that experience. Unfortunately, we have major inhibitors on achieving that at the present time.
Yeah, Matt, we do. We have certainly health systems haven't quite understood how to best implement it. They certainly don't know how to get paid for it. We have federal laws that are in the way. We have state laws in the way. We have federal reimbursements that haven't caught up. We have state reimbursements. So yeah, we really do have a morass of issues to kind of wade through. However, you and I and thousands of other people really do know that this is the future. This is how we're going to provide care, but also how we're going to be cared for and how we're going to engage our care. I mean, just really, the opportunity for increased health, increased in overall wellness is certainly there if we're engaging these new technologies and these innovations appropriately. I mean, we have massive doc shortages coming. I mean, I think the number that was thrown up, I think Dr. Sylvan Waller put this out there, who was our opening catalyst for the virtual care session, 99,000 doctor shortage by 2025. Longer wait times, much higher deductibles, but yet we all use these technologies, and so we've got to leverage them to begin to offset some of the pressures that are coming.
Yeah, at the end of the day, the macro trends are consistent globally. We have a growing population, an aging population, a sicker population in context of contracting more and more chronic conditions, and we don't, regardless of payment models, it isn't bending the cost curve. All that coupled with the fact that we have less physicians and less nurses available to treat that older, aging, sicker population is in fact the center of the problem, and ultimately the reason why the model needs to change. Yeah. How do we become more efficient to provide equal to or better than value of care at a reduced cost, or at least maintain current cost levels without steep inclines?
Yeah, no, excellent, well said. So it transitions us into our last couple of minutes here. So we will certainly publish out. I'm sure you and I will do a show here the next month or two on our second think tank. Just very excited, kind of the think tank structure. Not only will we publish our best best practices and key findings. But what's really neat about it is we always have 50 people. We invite 25 back from the previous session, and then we invite 25 new people, and we keep on doing this. And that way, our best practices, we keep continuity between each one, but then also we're always layering in 25 new people. So 50% of the audience in the group, the think tank, will be new. So we're going to get new best practices and then keep on building from what we've already learned, adding on new. And so after 2 or 3 of these, we're going to have one heck of a stable of best practices for healthcare across value-based care, connected health, and virtual care. So tell us, in 30 seconds or so, some of the next things for our next think tank, Tom, that you're most excited about.
I am most excited about diving deeper into best practices and potential use cases on how do we deliver a connected care, value-based care model. Potentially defining, there's some new participants in this think tank that have the ability to actually define what a intelligent medical home looks like, and with simplicity, that is able to transmit that data and engage that patient using AI type tools. I'm very excited to have this conversation with the think tank.
Wow, that's one heck of a cliffhanger to leave us on, my friend. But thank you, Tom Foley, Lenovo Health, co-founder of the Health Innovation Think Tank, along with me. Great to have you on the show. I appreciate you taking the time out of your busy schedule to join us. And thank you to everyone for listening and joining us today. Please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor and use the hashtag #ThisJustIn so we can respond to your comments from the show. In addition, all my content will be posted at justinbarnes.com. Thanks, everyone. Have a terrific week, and look out for all these health innovation think tank best practices coming your way.